අපිල් එලියා වෙළඳපොලේ අඩුම මිලකට රුපියල් 160යි.
Tonight, targeting the innocent, an explosion has been reported outside the Hamid Karzai International Airport after US intel reports warned of an imminent IS threat. Change the system. International security expert says that Sri Lanka still needs to do a lot more to stop the seeping in of extremist ideologies.
The spread of these extremist ideologies from the Middle East should stop. Zaharan's group attacked not only Buddha images, although we haven't publicized it much. They also attacked Mother Mary and Ganesh statues.
No one left behind. With Sri Lanka third in the Southeast Asian region for vaccine coverage, the WHO continues to urge more help for poor countries.
We've called for a time-limited moratorium on the boosters so that we can get every country vaccinating at least 10% of their population by the end of September.
The only solution, the UNP leader calls on the government to head to the IMF to find a cure for all the country's ills.
The remedy for this is to go immediately to the IMF to get assistance. Already we have received $720 million from the IMF.
All this and much more coming up on this Thursday, the 26th of August 2021.
දසනකාන්තී චූර්ණය සහිත ලීවර් ආයිෂ් දන්තාලේපය දත්වල ඇති ප්‍රශ්න 10ක් වලකයි.
From AdaDerana, this is AdaDerana First at 9. Live from Studio 24 in Colombo.
Good evening and welcome to First at 9. I'm Shanella Fernando in your top stories for tonight. A bomb explosion has been reported outside the Hamid Karzai International Airport in Kabul just hours after warnings were issued by US intelligence agencies of an imminent attack by Islamic State terrorists. With no report just yet on casualties, they do say, however, that the attack has been aimed only at local Afghan civilians.
An explosion has been reported outside the Hamid Karzai airport in Kabul a short while after British Armed Forces Minister James Heappey warned of reliable intelligence that an attack was imminent. With more details yet to emerge, according to available information, the explosion has only targeted Afghan citizens and no foreign nationals have been harmed. Earlier today, the UK's Armed Forces Minister spoke of very credible intelligence that Islamic State militants are planning an attack on those gathering at the Kabul airport in an attempt to flee Afghanistan. Late yesterday, Britain's Foreign Ministry advised people not to travel to the Hamid Karzai International Airport, where thousands are waiting for flights out of the country ahead of an August 31st deadline, when the United States and its allies will pull out the remaining troops.
I can't share with you the exact detail of what the threat is, but I can say that over the course of the week, the credibility of the reporting has reached the stage where we believe that there is a very imminent, highly lethal attack possible within Kabul. And as a consequence, we've had to change the travel advice to advise people not to come to the airport, indeed to move away from the airport, find a place of safety and await further instructions.
Britain has already evacuated more than 12,000 people from Afghanistan since its rapid fall to the Taliban and was planning 11 more flights today. Meanwhile, Belgian Prime Minister Alexander De Croo also announced today that the country has ended its Red Kite evacuation operations after US sources informed the government of the attack threat. Speaking at the same news conference, Defence Minister Ludivine de Donder said Belgium started to pull out its military forces and consular workers from Afghanistan, but some Belgian military forces would remain in the Pakistani capital Islamabad for the time being.
අඩසේ වසකට වැඩි ජනතා විශ්වාසය නව සංයෝගයකින් රයිනෝ රෝෆිං සහ සීලිං ෂීට්.
International security specialist Professor Rohan Gunaratna believes that extremism can be rooted out by reforming the education system and removing all religious hate speech aimed at other beliefs. He added that Muslim religious institutions should make more progress in doing away with Gulf ideologies of hatred towards other Muslims. Speaking to Indivari Amuwatta on our current affairs program at Hyde Park on AdaDerana 24. Professor Gunaratna also weighed in on the rise of the Taliban, noting that one of the main reasons for the group's resurgence was the inability of Western forces to recover the country from militancy to prosperity.
I go back to your book, Afghanistan After the Western Drawdown. You predicted 6 years ago. What are your predictions now? What do you have to tell us now with the rise of the Taliban?
I think that although the Western forces occupied Afghanistan for 20 years, they didn't invest adequately in developing Afghanistan. Their socio-economic indices improved marginally, but the focus was largely militarization. It is important to have a military presence. It is important to have an intelligence presence, but it is equally important for the socio-economic development to take place. In Sri Lanka, after the defeat of the LTT in May 2009, Sri Lankan government had 3 phases. The humanitarian phase, where they rehabilitated the terrorists, reintegrated them, gave them amnesty. Socio-economic development phase, where Northeast grew at a much higher level than the rest of the country. And of course, a political engagement phase, where through elections, the TNA and other entities came to office. I think that they got the equation wrong. I think it is very important what they did, because militarily they dismantled the Al-Qaeda and the Taliban infrastructure that trained 30 different terrorist groups in Afghanistan. But from that point onwards, the model they had to recover Afghanistan from militancy to prosperity, that model didn't work.
Speaking further, Professor Gunaratna expanded on how Sri Lanka's peace-loving Muslim communities were slowly but surely infiltrated by extremist ideologies.
Let's talk a little about Sri Lanka here. Easter Sunday attacks in 2019, shortly after which I spoke to you. We spoke about your predictions of the movement's expansion to our part of the region. What is the threat to Sri Lanka now?
The Sri Lankan Muslims beautifully coexisted with the Buddhists, the Hindus and the Christians. But after 77, when we opened our economy, our ties with the Gulf countries enhanced. And that is the time we had these Gulf ideologies coming. So Sri Lankan Muslims that embraced the Sri Lankan culture, where they wore the sari, where they wore the sarong, they slowly started to embrace not only the Middle Eastern, the Arab fashion, but also the Arab ideologies. And one of the strains of the ideology that came advocated al-wala wal-bara. That means loyalty to Muslims and hatred what is called unbelievers. They call it infidels or kufr. Not only that, these people who were influenced by these Gulf ideologies, they were against the very Muslims that have existed peacefully in this country for 1,400 years, the Sufi Muslims. So, for example, in Katankudi, several hundred Sufi mosques were attacked, homes were attacked, their businesses were attacked. And Zahran was one of them. So the spread of these extremist ideologies from the Middle East should stop. And we cannot afford to have these ideologies taking root in this country, because Zahran's group attacked not only Buddha images, although we haven't publicized it much, they also attacked Mother Mary and Ganesh statues. So attacking these idols, which Taliban did in Afghanistan, they attacked the most beautiful standing Buddha images.
In response to how Sri Lanka can do more to prevent the growth of extremism in the island, Professor Gunaratna says that at the start, more should be done by the Department of Education to root out extremism from school textbooks.
Do you think Sri Lanka has made improvements or progress to ensure that we protect our citizens from religious exclusivism, extremism and violence?
Government has made some progress, but they must do much more. For example, the O-level and the A-level textbooks in Islamic studies in 2017 and 18, they had inserted the preachings of Ibn Abdul Wahhab and his first disciple Ibn Qayyim. This is Salafi Wahhabism. They had included Yusuf Qaradawi, who advocated suicide attacks. So I think that we have to reform the education system. We have to make sure that there are textbooks that do not advocate violence against other communities, that do not condemn other religions. We should train a new generation of teachers that speak about commonalities in religion, the golden rule of all religions. Don't do to others what shouldn't happen to you. But the religious institutions, the DMRCA, the Department of Muslim Religious Cultural Affairs, their progress have been very slow. Similarly, the ACJU, the All Ceylon Jamiatul Ulema, they must issue a certificate for all clerics and certify that these clerics have also studied other religions, so that they will not preach against other religions, they will not condemn other religions. And they must produce a generation of Muslims who love this country. Zahran didn't want people to stand for our national anthem. He didn't regard our presidents and prime ministers as his leaders. His leaders were Abu Bakr al-Baghdadi in Syria and Iraq.
Sri Lankan Airlines today moved to reject allegations against the organization that claim that its management is deploying COVID-infected crew on flights. Issuing a statement, the national carrier called the claims untrue and misleading to the public, stressing that such moves are a deliberate attempt to tarnish its goodwill. The statement goes on to say that ever since the outbreak of the COVID-19 pandemic, the airline has strictly followed and continues to follow the health and safety guidelines stipulated by the Civil Aviation Authority of Sri Lanka. Sri Lankan concludes rather by saying that it has taken every precaution in ensuring health and well-being of its employees by steering a prioritized company-wide vaccination program while providing continuous awareness on safe working environment. More news on the other side of this break. Stay tuned.
Big 3.
Welcome back. In more news, the World Health Organization report stated that Sri Lanka's COVID cases have risen 33.9% in the week starting from the 9th of August to the 15th compared to the week before. This was mentioned in the COVID-19 weekly situation report published by the global health body for the Southeast Asian region. It added that the country has a test positivity rate of 15.8% and a 1.7% case fatality rate in the region, making it the country with the third lowest mortality rate, along with Bangladesh in the region. The island nation was also placed third in the region based on its vaccination efforts.
Sri Lanka's daily case numbers and deaths have been rising exponentially over the past weeks. The country confirmed its highest single-day caseload on Monday with 5,547 cases. According to the COVID-19 weekly situation report published by the World Health Organization for the week beginning from the 9th to the 15th of August, in the Southeast Asian region, Sri Lanka has seen a 33.9% increase in infections compared to the week before. In this regard, Sri Lanka is only second to Timor-Leste, which has seen an 84% rise during the same period. The report also shows that a majority of new cases in the week were reported in the Western Province, with the Colombo and Gampar district contributing to 45% of new cases. However, Sri Lanka has a test positivity rate of 15.8%, placing it at number 7 among the 11 countries in the Southeast Asian region. The report points out that the island has recorded the third lowest fatality rate in the region, along with Bangladesh of 1.7%. Meanwhile, according to the report, public health and social measures taken by Sri Lanka to prevent the spread of the virus in terms of the implementation of restrictions was the highest compared to the other countries in the region. In addition, Sri Lanka's expansion of treatment facilities was also cited as a positive, with the country's hospital bed capacity expanded to 30,373 beds at the beginning of the third wave from 10,764 during the second wave. Further, 116 new intermediate care centers were also established after the end of the second wave, raising the total to 158. The report also commends the Sri Lankan Triforce's assistance in making this happen. In the meantime, Sri Lanka's vaccination drive has placed the country in third place in the region in terms of coverage. So far, 22.3% of Sri Lankans have been fully vaccinated, trailing behind Bhutan, which has vaccinated 62.8% of its population, and the Maldives with 54.3%.
The Deputy Director of the National Hospital in Colombo, Dr. Chandana Gajanayaka, says that the hospital is able to take in more COVID-19 patients and provide them with oxygen due to a slight slowdown in new admissions. In the meantime, the Sri Lanka Army has expanded the COVID-19 treatment facilities at the Colombo South Teaching Hospital in Kalubovila by establishing 3 new wards with a total of 250 additional beds.
On the 24th of August, Sri Lanka has lost 198 people due to COVID-19. According to a confirmation by the Director General of Health Services, Dr. Asala Gunawardana, 146 of the deaths were people aged 60 years or more. 51 deaths were of people between 30 years and 59 years of age, while only a single death was reported below the 30-year age group. This increased the country's death toll to 7,948. In the meantime, 4,483 COVID-19 infections were detected across the country yesterday, including 11 foreign arrivals. Meanwhile, the National Hospital in Colombo says that it can cope with the current influx of patients and that a slight reduction in admissions has been noticed.
මේ සතිය පටන් ගන්නකොට හිටපු රෝගීන් ප්‍රමාණයට වඩා යම්කිසි අඩුවීමක් තියෙනවා. එම අඩුවීම මරණ සංඛ්‍යාවෙනුත් ඔක්සිජන් මත යැපෙන රෝගීන්ගේ ප්‍රමාණය යම්කිසි අඩුවීමකුත් හැම වර්ගයකම පොඩි අඩුවීමක් අපි දකිනවා. ජාතික රෝහලේ තවමත් අපිට රෝගීන් ඇතුළත් කර ගැනීමට සහ ඔක්සිජන් සැපීමට හැකියාව තියෙනවා. ජාතික රෝහලේ අධ්‍යක්ෂකතුමා විසින් ඊයේ දිනේ අතරමැදි මධ්‍යස්ථානයක් විවෘත කරා පුංචි බොරැල්ල ප්‍රදේශයේ. මෙම අතරමැදි මධ්‍යස්ථානයේ රෝගීන් 75කට පහසුකම් සැලසීමට හැකියාව තියෙනවා. පහුගිය කාලෙදී ගොඩක් වෙලාවට අපි අතරමැදි මධ්‍යස්ථාන නිර්මාණ කරේ සහ ඒ මධ්‍යස්ථානවල ප්‍රතිකාර ලැබුවේ එහෙම නැත්නම් රඳවා තැබුවේ කොරෝනා රෝගය පමණක් තියෙන රෝගීන්. නමුත් අපි බලාපොරොත්තු වෙනවා මෙම මධ්‍යස්ථානයේ කොරෝනා රෝගයට අමතරව වෙනත් රෝගාබාධ තියෙන කට්ටියටත් ප්‍රතිකාර ලබා දීම සඳහා මේ ක්‍රමය ඊටාම හොඳ ක්‍රමයක් වේවි. රෝහල්වල ඇති වෙලා තියෙන යම්කිසි තදබදය අඩු කරගන්න.
Meanwhile, the Sri Lanka Army has helped expand the existing ward capacity at the Colombo South Teaching Hospital in Kalubovila by establishing 3 new wards to treat COVID-19 patients. The 3 wards with a capacity of 250 beds were officially handed over to hospital authorities this morning by Army Commander General Shavindra Silva, together with the President of the Army Seva Vanitha Unit, Sujiva Nilsson. In the meantime, 2,139 patients were discharged from hospitals during the day. This takes the country's total number of COVID recoveries to 351,069. Further, with the confirmation of 3,522 new COVID-19 cases for the day, the total number of active cases in the country rose to 52,273.
A portal to obtain a smart vaccination certificate for those who are travelling overseas have been introduced by the Ministry of Health along with Information Communication Technology Agency as a document that can be used for overseas travel. Meanwhile, the World Health Organization has called for a time limit moratorium to halt the administration of COVID-19 booster doses to ensure that at least 10% of the global population are being vaccinated against COVID-19.
Right now, the only chance the world has against COVID-19 is through vaccinations, while ensuring strict adherence to health and safety protocols. With that being the case, vaccinating the country's population remains the top priority of any government. The World Health Organization continues to urge countries to forge ahead and achieve the necessary vaccine coverage to ensure maximum survivability.
When some countries afford to have a booster and others are not even vaccinating the first and second round, it's a moral issue. But it's not just a moral issue. With a big part of the population unvaccinated, especially in low and low-middle income countries, we're giving opportunity to the virus to circulate. So it's good for the virus, meaning new variants will emerge. And these new variants could be even more potent than the Delta variant. New variants could evade the vaccines that we're using now. The vaccines we're using may not be effective for the emerging ones.
With that, however, Sri Lanka has made significant progress in its own vaccination drive. By last evening, the country has conducted a total of 12,220,331 first-dose vaccinations. Of that figure, 6,517,540 have been completely vaccinated with both doses. Meanwhile, the country's health sector immunized 239,650 people yesterday alone. 70,215 of this number were first-dose inoculations, while the remaining 169,435 were second doses. In the meantime, second doses of the Pfizer vaccine were administered to the members of the public who hope to travel overseas at the Army Hospital in Narayanpeta today. In more news, the Ministry of Health along with the Information and Communication Technology Agency has launched a smart vaccination certificate portal for those with overseas travel plans. The travellers can make an official request for the certificate by visiting the ministry's official website. Meanwhile, several countries in the world have begun inoculating their public with booster shots. Israel, Russia and Cambodia are a few of the countries which have already begun the process, while countries such as Germany and the United Kingdom and the US are planning to commence booster dose vaccination soon. However, Sri Lanka is yet to begin any such program, which will only happen if the go-ahead is given by the country's health authorities. However, the World Health Organization is of the view that there are several factors to consider before administering booster doses.
On the science side, which we are tracking very closely, there was consensus that the data around the need for boosters is not conclusive. It is true that we need to follow very carefully the vaccine efficacy and effectiveness over a period of time, but putting together all of the evidence from all of the countries around the world, we are not at that point to recommend boosters. We have limited supplies of vaccines globally, and therefore those supplies need to go to the people who are desperately waiting for the vaccines. We've called for a time-limited moratorium on the boosters so that we can get every country vaccinating at least 10% of their population by the end of September. So we have only a month, and 40% of populations by the end of the year. That will reduce mortality significantly. And then, of course, we can scale up vaccination. And by then, there will be data on boosters. We also don't know about the safety of boosters, because when we talk about vaccines, it's not just the efficacy. What happens when you give a third dose of an mRNA vaccine or any other kind of vaccine? These need to be studied as well.
Leader of the United National Party, Ranil Wickremesinghe, called on the government to extend the lockdown further after considering health and medical advice in order to control the virus spread. Further, he also said that the government now has ways of minimizing the damage caused by the lockdown by obtaining financial assistance from the International Monetary Fund.
There is a rapid spread of COVID. The number of deaths came up to 5,000 on August 7th. 20 days later, by end of this day, it will be 8,000. Then 3,000 deaths have taken place in 20 days. That is a high rate. The people affected will now be about 50,000. And the epidemiology unit has said that there has been late entries, so they have to revise it by about 4,000, which means the statistics are also being questioned. We have to prevent people who will be impacted by COVID-19. What's happening at the moment is to deal with those who are already infected. Then if we stop the rapid spread, we reduce the number who are infected and control it. The government declared a 10-day lockdown for this purpose. This has received everyone's support. But according to medical advice or the specialist advice, this is not a sufficient period. Another week to 2 weeks are required. The other side of it is the economic damage that can be caused by a lockdown. But today we have reached a point where the damage caused by a lockdown is far less than the damage caused by not having a lockdown. The remedy for this is to go immediately to the IMF to get assistance. Already we have received $720 million from the IMF for our COVID control campaign. So therefore, I would like to recommend to the government, to the President, to the Prime Minister and the Cabinet of Ministers that we extend this lockdown according to medical advice, as just as much as we have supported the lockdown for 10 days, I am sure that the whole country will support a further lockdown.
Despite the quarantine curfew restrictions in place across the island, 81 people who attempted to violate curfew regulations were arrested by the police in the last 24 hours, ending at 6 a.m. today. In the meantime, Colombo District Secretary Pradeep Yasaratne announced earlier this week that only fully inoculated mobile vendors will be permitted to conduct trading activity in the district.
On Friday the 20th of August, Sri Lanka entered a 10-day quarantine curfew which is expected to be lifted on the 29th of this month at 4 am. The move came into place following pressure exerted by health authorities to do so in a bid to reduce the rapid rise in infections. As such, the only people allowed to travel during the quarantine curfew period are essential service personnel and people travelling on personal grounds. However, despite this being the only exception, the police arrested 581 people who were violating quarantine regulations in the past 24 hours, ending at 6 am this morning. Reportedly, a total of 58,995 arrests have been made since the 30th of October last year. In the meantime, the police have also inspected 934 vehicles and 1,170 people in total at the Western Province borders. Measures were also taken to beef up security at 13 police roadblocks set up at entry and exit points of the Western Province to prevent people from crossing the provincial borders unlawfully. Meanwhile, Colombo District Secretary Pradeep Yasaratne has announced that only mobile vendors who have been fully vaccinated will be permitted to carry out trading in the district during the curfew period. He added that mobile vendors engaging in trading activities sans full immunization will be punished in accordance to the quarantine law.
The benchmark all-share price index hit an all-time high of 8,920.71 points after rising 1.87% higher today, surpassing the previous record of 8,812.01 points on 27th January 2021. Meanwhile, the S&P SL20 index of more liquid stocks gained a staggering 157.47 points to close at 3,341.20. Now here's Dimanta Matthew with an analysis on how the market performed today.
Today we saw the investors coming in with a fresh mindset and a bullish attitude to the market today. Yesterday, towards the second half of the session, we saw a bit of a setback in the market where we saw some profit taking after the significant gains in the first half of the session. But today is another new day and we saw continuously strong buying interest emerging in the market, and we saw the overall mindset of the investors in a very positive attitude. So with that, throughout the trading session, we saw the market on an uptrend. So overall, the ASPI was up by 164 points, reaching 8,920, which is an all-time high for the all-share price index. So the highest closing level has been reached. We are in new territory where the index has not reached before.
The selling rate of a US dollar remained at 202 rupees and 89 cents today as well, the same level which was reported yesterday. Let's now take a look at how the rupee fared against other major currencies during the day. With that, we wrap up tonight's edition of First at 9. Thank you for joining. I'm Shanella Fernando. Have a good night.